Hello, students. How you doing? Dr. Tony Scuderi here for you. Welcome to Marriage and Family. Um, I'm looking at your first forum and your responses to the forum. They look really, really, really good. Thank you very much for them. Seems like I've got a really um, good bunch of students right now, and I appreciate that. Trust me. What I'd like to do today is spend a little bit more time with you. No extra work. This is for you based on your responses. And it's a PowerPoint presentation I'd like to do with you. Um, and it is on addictions and family treatment. It's by Michael Ryan, social worker, and he's also an addictions counselor. So, what I would like to do is I would like to do this for you and try to see if I can go as quickly as possible through it. Because I'm not going to ask you to do anything like, write a paper or anything like that. If you want to comment on this, you're more than welcome to. So, anyway, uh, first thing we want to take a look at is what addictions in family look like. Basically, there is no real definition. All right, there's no real definition to what an addiction is. Right, cultures see it differently, people see it differently, belief systems are different. Things change as time goes on, and even the word family. When I was growing up, family was mom, dad, the kids, and the dog, and that's it. Now it seems like that we have families that are blended, interracial, intercultural, single parent. Um, all of these things can be functional and or dysfunctional. The idea of a family, either. Oh, and one more. I'm sorry, one more. Which I really have a problem with, and that's usually when they sit there and say, if you have a job, oh, we're one big family at work. When actually you're not. But if that's what some people want to believe, that system works as well. But the idea of family is some type of involvement at some type of level. Um, so, accordingly, we can define family as your closest emotional connections. So, given this definition that you see here, that would entail things like work families, neighborhoods. My uncle John, who's not really my uncle, but I call him my uncle. All right. So whatever you say a family is what a family is. So there are certain theories behind it. One of them is called family systems theory. One of my doctorates is in family therapy. So my theoretical basis, as you'll see down the road a bit, is Minuchin. I deal a lot with families, with boundaries, and interconnectedness and things of that nature. Well, it's all in this realm called family systems. So, family systems theory is a collection of therapeutic approaches that share beliefs effectively of family levels, assessments, and interventions. How we look at families, how interventions are done between families. So, what I see when I look at a family is we have this whole thing called a system, how a family works, right? And the dysfunctions within that system are embedded from the time of its formation. Okay. So systems have problems in them. And the way that they work is they work within the dysfunction. And the dysfunction eventually is seen as normalcy. I call this a functional dysfunction. It's dysfunctional. It's not supposed to work, but it works. Unfortunately, when we have this functional dysfunction, it's a set of comfortability within the family system. All kinds of things happen with that. Okay. So when it comes to substances, family therapy and substance abuse treatment, we want to look at things in two ways. One is family strengths and the resources to help the addicted person work through the addiction or to develop ways to live without the addiction and to get rid of or to ameliorate the impact of the dependency on both the patient and the family. Now, one thing I want to make clear here, a lot of people will sit there and say, oh, my son is addicted, my daughter is addicted, I'm addicted, my wife is addicted, my husband's addicted. But when we're dealing with the family, I want to say the entire family system is addicted. If one person has a problem, the entire system has a problem. Now, given that, if we have one part of the system that changes, then that whole system has to change. And if it doesn't change, it obliterates. All right. So, what am I saying there? What I'm saying is, in this type of system, if somebody's addicted and they change, they stop using, right? Then that entire system that's used to enabling the patient or berating the patient or something like that, that has to change. Just the way the system changed when the person became an addict. We have a sense of normalcy in the beginning where everything is running smooth, and then all of a sudden, things start missing, for example. Money is gone, lies start to happen, right? Somebody is found with drug paraphernalia. At that point, the system changes. It's no more normal. It's now totally off center. It's totally dysfunctional. And that eventually is what the system works on. The whole system is changed because of one item. If the person goes into recovery, once again, that system changes. It goes into a more unique way. It'll never go back to the beginning, but it goes into a more unique way of functioning in the future. It may be dysfunctional, but it's more of a functioning, dysfunctional function. All right. So there are many different modes that you will learn about in this course. Family therapy has been developed by many years, right? MFTs, marriage and family therapy, has become a mode of psychotherapy for people. Here are some examples of hopefully some therapeutic techniques that you'll learn and take a look at. You've got marriage and family therapy, you've got strategic therapy, cognitive behavioral family therapy, couples therapy, solution focused therapy, right? Um, these are just a couple. These are the four main ones that you'll see. There are many others, and I invite you to take a look at the others online and see exactly what you like and what you don't like. The disease model. We all understand that addiction is a brain disease, right? So there's a model that says that. So the family system model, the approach to that is cognitive behavioral. In cognitive behavioral therapy, we the main premise is if you change the individual's thought, the behavior changes. Okay, change the thought, change the behavior. Once the behavior changes, then the whole system starts to realign all over again. Okay, this talks about a multidimensional family therapy. Multidimensional is exactly what it says, on different levels, different dimensions. So everybody in the family responds to the addict in different ways. No one mode of therapy works. You need sometimes different modes in order to reach the system and make the functional dysfunction a functional function, if you will. Right? So getting back to the cognitive behavioral approach, one of the things you want to do as a therapist is utilize, for heaven's sake, utilize the ABCs of CBT. Right? So what is the activating event? What started? What got the person to use? And you have to pursue that. That's the activating event. The B, the belief. What does the person believe the addiction is doing? And based on the activating event, what got them to believe that it works for them or doesn't work for them? Okay, learn that. Find it out from them. C, the consequences. What are the consequences? What are the problems that are associated with the patient that believed in the activating event? So there's something that went awry. Something happened, they bought into it, and something went awry. Those are the consequences. It could be kicked out of the house, a bad addiction, going to jail, killing someone, whatever it may be, right? It's the activating event, you believe the consequence. Once you get to this, you do the work. You start doing the systems theory, you start doing the change of thoughts, the change of behaviors, all these different dysfunctional processes that people go through. And then you get the person to the D, which is the disputation. person takes their belief system, right, and the consequences of it, and they fight it. And the best way for you to approach it is to sit there and to have them make a list of the benefits and the non-benefits that the addiction got them into, the costs, if you will, the pros and cons of it. And let them see it, list it for them, let them see it. And once they see it, all right, now you start doing your work. You see what they buy into and what they don't buy into. Right? Let them argue it. That's your disputation. And then start working your magical therapy through there. And then after that, their experience. What are they going to do afterwards? What are they going to do afterwards? So once they get the good therapy, they've found out what got them started, how they bought into it, what the consequences were, how they argued with it, and now what they're going to do in the future, right? Their expectations from there. A, B, C, D, and E of CBT. So as it says here, some goals are to include families to become aware of the family needs, providing genuine enduring healing for family members, improving communication, helping the family make interpersonal and intrapersonal and environmental changes affecting the persons using alcohol and drugs, and keeping the substance user from moving from one generation to another. So once we get the identified patient to realize that they're doing that they may be, and I put that in quotes, you'll see why, maybe the problem. And once you do your work and you get them to stop, that whole system has to stop. Now, let me just quickly stop here for a moment and tell you this. The identified patient sitting in front of you as the problem may not be the problem. Many times when I've done treatment over the years, I have a family in front of me, and the parents will sit there and say, "Here's my son Johnny, and Johnny's been, I caught him doing reefer, and then he started doing cocaine. Look at him; he's just did this and that and the other thing. He's not doing school. He's stealing from mom and dad and everything else. He's a bad kid." After I get them out of the room and I get a trust alliance with the patient, I talk to Johnny and I find out what's going on with Johnny. And I do the CBT thing. I try to find what the activating event was, what the belief both within the system's dysfunction was, as well as the belief in how the drug is going to help them deal with that dysfunction, right? And then the consequences of it, which basically is here in front of me, right? What I find very interesting most of the time is that patients, even though they've had the addiction, the main problem is family, mom and dad, right? So this is why we call it an identified patient. The identified patient carries the symptoms of the family system. So if we recognize that as clinicians and we see that the symptomatology of the patient is right there, then we can take a look at what the family is dealing with, and now we can start to restructure the family or refer them to somebody that knows what they're doing and restructure that system. As you're restructuring the system, one way to do that is to work with the identified patient to change their behaviors, and then have the family, have the mom and dad buy into the behaviors through reinforcement, positive punishment, negative reinforcement, positive reinforcement, negative reinforcement, positive punishment, negative punishment. That's behavioral therapy. Okay. If you don't know what that is, look up behavioral therapy. Okay. But once they buy into that and they see that the identified patient starts to change, they have to change and help the identified patient get better. So the identified patient is helping the family system get better. The family system is helping the identified patient to get better. If the family system is an enabling family system, we have a problem. Because what happens there is as the patient starts to get better, the family can't cope, because they're so dysfunctional that what they've done is they've taken their dysfunction and superimposed it on the patient. As they superimposed it on the patient, what winds up happening is it keeps the patient sick. It keeps the patient circling into sickness. So the patient gets sicker. In the meantime, the family system doesn't have to look at their own issues. So they don't have to change. As long as the patient stays sick, the dysfunction stays within the family system. And that's where you have a functional dysfunction. Well, codependency is called enabling. So if we pull that apart and we sit there and we treat the patient and we get that identified patient to start to do different things and to do different behaviors, the family system itself has to be able to tolerate it. If not, it will fall apart. And then the patient has to make a decision: buy into the system and continue in the addiction, or get out of the system and get on their own. And that's a very, very, very painful place to be. At that point, the patient can go one of two ways. The patient can either buy into the system and continue to use, or the patient leaves that system and gets on their own. And if the patient leaves the system and gets on their own, that could be a whole new life. And part of this is also 12 steps, 12 traditions, AA, and A. So when we're looking at a family system, depends on your theoretical basis and how it works, as we're going through some of them right now. This is what you want to take a look at and be very, 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 very much in tune with who the identifying patient is. All right. So another reason family therapy works, because it provides a very neutral forum. You are that neutral forum where family members can come in with a third party removed that's not in a dysfunctional system and can actually identify, or as Mnuchin would say, or I'm sorry, not Mnuchin, but as Mary Bone would say, join with the family, right? But yet be apart from the family. So you're looking at the family, you're seeing the dysfunctions of the family, and you're able to sit there and say, "You're telling me this, but this is what I'm seeing. This is what I'm doing." Okay. What Carl Whitaker used to do, he's another family therapist, is he used to go in to the family system and literally become part of the family system for a while and watch and observe. So whenever the family system would go awry, he would, in the session, he would talk about it, and the family would sit there and say, "Yeah, but I told him to do this," and Whitaker would turn around and say, "Yeah, but this is what you actually did," right? So that's a really effective thing, but it's not that practical in this day and age. So family therapy applies very much across cultures, right? All cultures, all religions. All you have to do is join with the system. Once you join with the system and you get to understand and you get to identify with the culture and you have a good cultural identity, then you can understand how the system works. Because some addictions are intergenerational in nature. They may be accepted in cultures. And then they come to the United States and they come to you, and all of a sudden it's not accepted, right? I remember going into when I was looking for a house to purchase with my wife over here in the Sacramento area. The real estate agent took us around, and all of a sudden I walk into this house and I see two hookahs, beautiful, design and all that stuff, and I'm sitting there going like, wow, and you could see the water in them, so that actually they were used. For those of you who don't know what a hookah is, it's one of those large bongs, if you will, that holds hashish in it that they smoke. It's some countries will have hookah bars, and they'll start sharing the hookah pipe and smoking it all around. Well, very dysfunctional system. And when that happens, the whole family sees that as not a problem. And if they see it as not a problem, we now have an addiction within the family. And that's what you have to deal with. So learn the culture. Right? You're going to have a class in cultural identity, right? Learn that, because you cannot treat every culture the same way. Diversity in cultures, especially in the addictions field, is the plethora of things that you're going to be looking at. So look at it, join with the family, understand the culture. If you don't know it, ask the patient, right? Ask the patient and walk them through it. Identify with it, get them to belong, get them to accept. So family therapy overall is a unit of treatment where the family and the individual interact within this family context. The person that uses the substances is called someone that works within the system or a subsystem. Okay. They have symptoms, as I said, that have serious implications on the entire family system. So this is basically, it says here the family relationships within the subsystem are the point of therapeutic interest and intervention. Well, yeah, Because if you have that whole family system that works one way, and then you have the subsystem that works another way, as I said earlier, when that system starts to work within that whole system, that subsystem works within that whole system, that system changes. And if that system changes, we have a main big dysfunction. So your job is going to be to have them talk to one another, right? Learn problem solving skills. You can get all this information on the net, and there's also problem solving therapy. It's a type of therapy that was formed from the addictions thought. But learn problem solving techniques. Get them to talk to one another, right? Whoever has the questions has got the answers. Think of it this way: you don't have the answers to the problem, even though you might. Okay, let them come up with the answers. Again, this goes to motivational interviewing. You let them talk, you let them discuss, you pull out from them, you lead them, and you let them pull out the answers. How can this problem be solved? When they come up with something that they agree upon or something that you assist them in agreeing upon, you get them to contract to it. You think you can do this? Try this for a week and come back to me and let's see what's worked and what hasn't worked. And then you work on the stuff that hasn't worked. That's how you do this. That's how you get them to talk to one another. Because if there's a blaming finger pointing at the addict and the addict is over here and there's resistance to that, right? What you have to do is you've got to get them to close that finger. So that instead of that, you got a fist bump instead of a pointing. You know what I mean? So the way to do that is exactly what it says here. You take a look, you facilitate it, you get them to ask questions and answers, you have them come up with solutions, and then once they come up with solutions, you have them turn around and you have them practice it, come back and keep it going. In the meantime, push abstinence, push 12 steps, Al-Anon, Alateen, if need be, AANACA, all of those. Sponsorship, a must. Have them do some literature, have them read the book. Right. So the impact of substance abuse on families. For those of you that may have had or know somebody that's in addiction, you know the impact, right? You're likely to find isolation in the family system. You're likely to find lying in the family system. You're likely to find things being hidden in the family system. Here's mom cleaning the house or dad cleaning the house, and all of a sudden, they're in the kids' room and they're starting to sweep under the bed, and all of a sudden they hit something that goes tink, and they get the broom and they pull the thing out, and there it is, the works. They got a needle, they've got a box with heroin in it, and et cetera, et cetera, et cetera. Or you're cleaning the bathroom and you're cleaning things out, and all of a sudden you find in the back of the toilet a bottle, or you lift up the lid of the toilet and you see what's inside the toilet tank. Not the but the big, you open that thing up and you find a bottle and you're chilling out. So, all these different things change the system, right? So everything that happens within the system has a different effect. Now, extended family members, um, you know, grandpa, grandma, aunt, uncle, brothers and sisters that moved in, whatever it may be, everybody within that family system has feelings and experiences: disappointment, abandonment, anger, anxiety, fear, concern, embarrassment, guilt. Guilt is a big one. Shame should be in here, and shame is not, but shame is a big one. You know, enablers will, as the last sentence says, wish to ignore or cut ties with the person abusing substances. Usually, they will ignore the person or cut emotional ties. They'll go into denial. This isn't happening. This isn't happening with my son, Johnny. Johnny's a good boy. Yeah, Johnny's a good boy when he's not high. When Johnny is high, Johnny's not such a good boy because Johnny steals, Johnny lies, you know, he does all kinds of things. But the family enables that behavior. So again, be cognizant of this. Now, when it comes to addicts that live with a partner, let it be heterosexual, homosexual, it doesn't really matter. Partner is a partner, right? If you have even a family system, you live mom, dad, and kids, right? everybody in that system needs help. As I said earlier, everybody's the addict, not just the identified patient. The treatment for either party that you do affects both people, as I already said. So the person is chemically dependent is one thing. The people that are not chemically dependent is another thing. But they need treatment to understand the addict. The addict really needs to relearn what it's like to live in normal life. The person that is not addicted necessarily to the drug or substance has to learn steps and things to do to deal with this patient. Are they going to be firm? Are they going to be lenient? What are they going to ask for and demand? Are they going to talk? How do they talk? How do they listen? Because a lot of times the family system doesn't know how to listen, and this is one of the things that keeps the family in their addiction. You get the daughter that sits in front of you and says, "Mom, you never listen to me. Dad, you just don't care." Mom and dad are looking at them saying, "What are you talking? I always listen to you." When you get into it and you pull mom and dad in separately and you ask them, "Tell me what happens," you're going to find that they don't know how to listen. They know how to dominate, they know how to be domineering, but they don't know how to listen. So again, you want to treat both sides of the coin here. So if you live with a spouse, if you live with a partner, if there's minor children involved, all right, look up data on all this stuff. Look up data for heaven's sake. But there are, you know, long-lasting effects if parents are using. It's not just, oh, my kid doesn't know I'm using because when I drink, I go to my bedroom and I fall asleep. Kid knows what you're doing. Oh, he never sees me shoot up. I don't smoke in front of my children. I don't drink in front of my children. And I always look fine. I always look fine. You look like hell. You don't look fine. You really don't. And this is one of the biggest lies an addict has. I can do this. I'm okay. I know just how to do it and when to do it. My kids are at school. I get high when they're at school. They don't see me, so how could you say they know? Children are not stupid. They know. They just don't know how to express themselves, nor do they know how to tell you to stop doing it because they're afraid of you, the parent. Who do you think you are? You're trying to tell me I'm your mom, I'm your dad. That's the attitude. So it affects the children in the long term because they're literally being abused in a way, if you will. Parents, if you think of it that way, they're abusing the children. And when you're abusing the child, what happens to the child? You have trauma. Sometimes you have a complex trauma involved. And when this starts to happen, now you're dealing with a child that has a tremendous amount of pain within them. And when that pain uh, gets to a certain point that they can't take it no more, they take that pain and they turn it inward. When they turn that inward, that gets into dissociation. And these young children, 4, 5, 6, 7, sometimes earlier than that, much earlier than that, dissociate, and that's a lifelong thing until things start to happen. Right? Look up dissociative identity disorder and see what that says. Um, it does have a detrimental effect on everyone. Now, if the spouse is abusing, the other spouse, if one is using and one is not, one will protect the children, right? And assumes that all the parental duties. Now, as it says here, it's likely to protect the children as soon as the parental duties not fulfilled by the parent abusing substances. If both parents abuse alcohol or illicit drugs, the effect on the children worsens. Absolutely. And the other thing, it worsens, in my opinion, regardless if both are using or not. If one is using and one isn't, it still affects the children, makes them worse. What's wrong with daddy? What's wrong with mommy? How come whenever I go to daddy, he pushes me away or hits me? How come daddy's always yelling? How come mommy's always away? How come mommy just yells at me, and doesn't eat with us anymore, or whatever the case may be? If they're both using, now we get into major abuse situations because now you have absentee parents. You're high, you're using, you're not paying attention to the kids. You're absentee. Now the kids are pretty much on their own. And this is where you'll find children within the family system, the older children being parents to the younger children. So in an addiction, parentification can be an issue or a problem. So the addict starts to make the child the parent. And as the addict makes the child the parent, what happens then is that child becomes the parent and doesn't have a childhood. And then the younger children start to emulate the older child. And then you have all kinds of dysfunctions that happen. You can just imagine when all of a sudden the parents themselves try to rule the roost. That doesn't come over too well. And again, in that system, especially if the children are latchkey, where the older gets the kid and then, they take them home from school and, the older child takes care of the child, or if mom or dad go out in the evening, that happens. There's a lot of trauma and a lot of dynamics in there. So you need to really take a look at everything, because the other system comes in with blended families. You have uh, family A over here where mom and dad are divorced, family B over here where mom and dad are divorced, and then somehow the couples get together, in these two separate families. The father in this meets the mother in this, and they get married. The mother in this meets the father in this, and they get married and they live their separate lives. So now they've got two sets of children. Who sees who when, who's got custody when. It's a very complex situation here. Step families sometimes can work and sometimes can be very problematic, especially when it comes to discipline. You're not my daddy. You can't tell me what to do. You're not my mommy. You know, I don't like you. That could be problematic. Because it says here it presents special challenges. Substance abuse can intensify the challenges that are already present within the blended family system. They are impediments, they are problems, to integrating, to blending together, the stepchildren and the family. It's not about mom and dad. Yeah, mom and dad may fall in love and be in love with each other, but the ones that suffer are the children. Mom and dad they're gone, they're divorced. They don't want to be bothered with each other if they can help it, right? But the children are the ones that suffer. So the clinician should be aware that the blended family dynamic, right, requires additional considerations. Be very careful when you're dealing with blended families because sometimes the children will also be there to placate the parents, even in an intact family, if you want to call it that. Um, the children want to placate, want to take care of the parents. That's called parentification. When the children want to take care of the parents and be parents to the parents, that parentification can be very, very, dysfunctional. Well, it is dysfunctional. Not very, it could be, but it is dysfunctional, right? Because now the children take over. Now, if you've got two blended families with two different philosophies and they try to take over, and the parents, think it's cute, or the mom and dad don't maintain their position in the family system as mom and dad and let things go because they don't want to rock the boat, that's going to be problematic as well. So one of the things you want to look at is family positioning. You know, who's the mother of the house? Who's the father of the house? Who are the parents of the house together? Are they talking to each other? Are they joined? Can the children see them as being joined together as one unit? Right? Are they teaching the children not to be separate, but also to be one unit so that when they work together, they can blend together so things work? You throw addictions into this, that whole system goes awry. And then we have to have other problems. Older children. If you have older children, um, that's growing children, as it says here. An older adult with a substance abuse problem can affect everyone in the household. Absolutely, especially if you're looking up to that person, right? Additional resources may be needed to work that treatment. So call the MFT, call the therapist. Don't ever treat anybody that's over your head. Recognize the problem, state the problem, but refer, refer, refer. Always, right? You are a counselor, you're not a psychotherapist. You can ask questions, you can dig a little bit, you can probe a little bit. But once you start to find out that, hey, there's something totally awry over here, don't play doctor. Don't try to fix this because you can't, right? So As it says here, additional family resources may be needed to mobilize or to treat the older adult. As with children, abuse and neglect, elder maltreatment can be subject to statutory reporting requirements and local authorities. That's right. That's right. You are a mandated reporter. Remember Tarasov law. Tarasov law sits there and says, that was the law that turned around and created mandated reporters. If you're not familiar with Tarasov, look it up. Okay. If you want, you can even type my name in into the Google search engine and put Tony Scuderi and PCHD, right? And up will come transcripts from a court case that I was involved in my first couple years as a therapist in Philadelphia. If it weren't for that case and what I did in that case, Philly probably wouldn't have a Tarasov law. It's because of what happened in that case that the judges, the Supreme Court of Pennsylvania, mandated the Tarasov law for mandated reporters. It's the Hausler case. So one of the things that it says is, as a mandated reporter, if you see or if a patient or anybody tells you about child abuse, elder abuse, um, uh, child sexual abuse, elder abuse, right? Um, that type of issue, you have to report it. You have to report it. If you don't report it, you're liable. Sexual abuse, child abuse, elder abuse. It's statutory. All right. So a client is an adolescent and lives in a family of origin. Family of origin is the biological family, not the divorced family, right? That's called a blended family. The family of origin is the family that you grew up with, mom, dad, the kids, and the dog. Okay. So when the adolescent in the family unit uses the other brothers and sisters, the siblings, um, their needs may be ignored by the parents because what the addict has done is taken the attention from the parents away from the younger siblings. So the younger siblings are left on their own, and that gets very chaotic. Or they may minimize the concerns of the other children. Oh, it's not that important. Look at your brother. We've got more problems than that. Well, kids don't understand that. Children don't understand that. For them, it's monumental. Think of it this way. You got a cold, right? You as an adult, you got a cold. You're miserable. Nose is stuffed, right? You're sneezing all the time, maybe coughing, maybe some body aches, right? I'm not sneezing, I'm not coughing, I don't have body aches, so I can't relate to that. And you sit there and you go, oh my God, it's absolutely terrible. you, oh, my back hurts. Oh, this is terrible. This is awful. Oh my God. And I'm sitting there going, will you grow up and stop it? I don't have time for this. You know, I don't understand. You're right. I don't understand. I don't understand because I'm not feeling what you're feeling. Okay. And don't ever say to a patient, oh, I understand. I know exactly I know how you feel. No, you don't know how they feel. You will never know how they feel because you're not that patient. You can relate to what they feel. You don't know what they feel. Right. And that's the problem here. You're in a family of origin. The adolescent is using the older one, the younger siblings, the younger kids, regardless of how young they are, if they're neglected and they have to do on their own, a lot of things internally happen. Resentments build up, angers build up, stresses build up, frustrations build up, trouble builds up, and pretty soon, the possibility, well, if Johnny's getting all the attention because he's using, I'm going to get some attention. I know where the liquor cabinet is. Now, all of a sudden, you've got a 13-year-old that's using cocaine. 6-year-old is seeing that all the attention is given to the 13-year-old. 6-year-old starts thinking, he's doing that stuff and he's getting all the attention. I'm not doing anything. I'm not getting any attention. There must be something wrong. I'm going to go into the liquor cabinet and see what happens if I have a little bit too much of what daddy drinks or mommy drinks. The kid starts getting drunk at 6 years old, which has happened, right? And then mommy comes over and now gives negative reinforcement to the child. and sits there and says, you shouldn't be drinking. What's the matter with you? So they're punishing the child, but at the same time, it's negative reinforcement because what's happening is mommy's reinforcing that behavior on the child because the only way that that child can get attention is by doing something wrong. If the child stops drinking, then mommy's not going to pay attention to that child anymore and pay attention to the crack addict. That's how it works. So this has to be brought up within the system, as counselors. So at least one parent, you know, there are issues there. So the unfortunate modeling can set in motion a combination of physical and emotional problems, and that can be very dangerous, right? It can be very dangerous. I've known people that have died because of this. So someone that's not identified as the client is abusing the substances. This happens a good bit where the kid's got the problem because the kid's got tattoos, a nose piercing, and rings all over the place, right? And the parents are saying, "Look at him! Look at this kid. He's turned into a bum. He's turned into this. He's turned into that." And then when you pull them out of the room and you talk to the kid, he's rebelling against what the kid is saying. So when someone in the family, other than the person with the presenting system, is involved with alcohol or drugs, the issue of blame, responsibility, and causation arises. Who are you going to blame? Who are you going to cause to be the problem? Usually, I'm drinking because of what this kid does. He doesn't listen to me. Well, if you listen to the kid would listen to you. Problem is, you're not listening to the kid. You're listening to the substance, right? So, with your help, the family should refrain from blaming, teach them not to blame one another, but to listen to one another, right? Encourage them to reveal and go to a marriage and family therapist to help repair the interactions and the family system. Point out the dysfunctions and refer them out, right? Create the conditions for continued healing, not create conditions that will continue the substance use. If you do nothing and try to treat this, you will be, creating conditions for continued substance use because you don't know what you're doing. Probe, talk, listen, find the dysfunctions, note, 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 right? Report, report, report. Refer to a family systems therapist. Get a release of information or talk to that person and talk to them. Give them your notes and let them exchange to your notes as well. All right, I'm going to stop here and we'll do approaches to therapy in another class. Okay, so if you have any problems or questions, put them in the forum, and I'll attend to them either in writing to you individually or I will attend to them in a Zoom that addresses those issues. Okay, so week 2, we'll take a look at approaches to therapy. Thanks a lot and hang in there. Again, you really don't have to do anything with this except look at them. I'm not asking you to do a paper or anything, no extra work. But I thank you for looking at this and I hope it helped. All right. It would be nice to get some comments as to if this helps or not. All right. Take care. Talk to you soon. Bye.